Hello, everyone, and maybe good late afternoon. Yeah, so uh, it's so great pleasure to be here with this session, and I wanted to explore and share with my project is how to build the trust in digital health and blockchain-enabled governance for patient-centered care and system development. And let me allow me to introduce myself. And I'm PhD at public policy at Lingnan University, and I was be a senior consultant in PricewaterhouseCoopers to be a business consulting, and especially focus on the artificial intelligence and the large-scale health industry. And I also be a project researcher in China Development Institute. It's a think tank in China. And so please return our material topic. And first, our project is about the Mauritius. And as we know, the Mauritius government wanted to build the patient-centered ecosystem. So, and they wanted to build the digital transformation. So they published the one and is the digital health architecture project, and offer at meantime is offer published one patient and one record with UNDP. So they wanted to build a patient-centered in-health ecosystem. On the other hand, the Mauritius government wanted to publish the Data Protection Act 2017. And they wanted to ensure the compliance in their services for the citizens. So, but now the current state is about the key challenge: lack of the transparency and the patient consent. There are the three aspects for the challenges: is consent management mechanisms, and real-time the notifications of data accesses, and the transparency audience choice showing how data is used. So this invisibility of data sharing the undermine citizen trust in the healthcare and welfare system. But why it matter? Because the critical for materials and Mauritius as a developing country, even other developing country is also. So they wanted to build the modernizing the healthcare and protecting the rights. The first aspect is transparency gaps that undermine patient trust. And the best important is patient can't see or control how social services use the health data. And the legal risks is so important. And for last is transfer-based need empowers the patient. And so if these challenges are not resolved, the Mauritius will be facing the complex risk of this system. So the current state technological architecture is mismatched with the correct surrounding policies and governance mechanism. But they will causing the two risks. One is legal risk and the second is trust risk. So why must the trust layer be embedded? Because at the technical level, governance need to put in the patient pack of the century of the data governance. So the Mauritius governance facing the national certification system and interdepartmental platform is not enough. But the government, it hasn't addressed the critical issues of who accessed my health data, when, and for what purpose. So the citizens want to know. And our design will bring the Mauritius citizens to have achieved some the significance, the celebrate citizens' rights, and reduce compliance risk, and rebuild trust, and in line with international trends. So our team built a health privacy protection program promoted by the government, supported by FLock and UNDP. And for our design, designed for the user is the patient is the user. So the patient acts as both a data user and a data owner also. And the government empowers them over the visibility and control their health data, thereby protecting their privacy and enhancing government trust and satisfaction. But and there are have the three stakeholders for the one stakeholders, the vulnerable patient, like elderly, disabled, and a chronic patient, they will facing who frequently impaired with healthcare and social service need the control over their sensitive health data. And for healthcare providers, so nature like nurse and the medical staff will require clear compliance framework and they need to reduce the legal limit and the administrative anxiety. And the last is for government agency is more influence for the Ministry of the Health, the Social Services, and data protection office need to comply and to build some the citizens to have the rights protecting. So this is our team to build solutions. So as this seen in the picture, we use the platform used the hyperlatent fabric to storage the constant metadata and the purpose. And in our design, we must to keep sure the sensitive health information like in the trust database. And our goal of the solution will be to achieve the three areas. The one is enhanced transparency and accountability. The second is earning with the data protection at 2017. And the last is strengthen the patient trust in digital health governance. So this is our team to solutions. And the core platform features about including patient dashboard and the smart company in Harvard. Our team wanted to achieve the embedded audience motions and combination who the national electronic health ecosystems. And the technical architecture, including the 4 layers, is about one. Blockchain layer and the hyperledger fabric with a private channel for healthcare privacy. So owning consent metadata should stored on the chain, never citizens' medical records. And the second is integration layer, not just connecting blockchain to access the e-health system. And for user interface level, React web portal and React native mobile apps providing issues consent management for patient and healthcare providers. And for privacy analytics, the Flock and federated learning inference population health instance without exploiting individuals' patient data. So, and our pilot outcomes may be achieve transforming the healthcare trust. They are focused on the pilot will divest measures, patient empowerment and system transparency across the Mauritius healthcare. Our care achieve will be achieved. Will be sure that all data accessed across the trigger real-time patient notifications, and for the smart companies limit and authorize the data sharing. And for the immutable blockchain records provide continuous accountability. And for FLock, the UNDP project supported by FLock, so the privatization of patient privacy. The hospital can collaborate on the training of model to detect disease and predict patient outcomes, or personalize the treatment without sharing confidential patient records. So the model learns from the data locally and only updates model and parameters. And for the recursive bias, by training on the diverse data sets from various demographics and locations, the resulting AI models are more robust and less prone to the biases. They can address from training on the limited. So in terms of the data site, And for the blockchain for integrity, a blockchain can be used to create an immutable log of the Intel training process, and this ensures transparency and auditability, which is correct for regulatory compliance and for building trust among the possibility. And for intent, it can be proven that a particular model was training on the safety levels. They can cite without releving of the specific of that data. So this is for the global viewer. And for the scalability, we also to achieve from Mauritius to African impact. The firstly is about for Mauritius local citizens. They will achieve multi-shares matters and the digital health agency or will achieve the digital transformation, will ensure long-term sustainability by integrating consent and the transparency. Maybe it's so important, and the data wallet for patient control records. But for area scaling, we can to achieve or the African impact or another country promotion the motionism. To promote adoption, the UNDP will develop Shine and make the Mauritius as a model for transnational policy analysis to expand into other African nations. And for the possibility of the adoption, African region and small island countries generally face issues such as limited resources. Users tend to have a higher acceptance of the solution that ensure data privacy. And in the world, we are facing the after COVID-19 pandemic. So the demand for the digitalization in public health has increased. So the government-related health policies require compliance and the implementation of privacy mechanisms. So thank you.